Hi, everyone, and welcome to the latest edition of Psych Health and Safety Live. Today, I've got Alicia Pappas, and we'll be talking about the podcast episode from Monday this week, which was all about psych health and safety in the healthcare setting with Dr. Jan Smith. So hopefully we'll get a fair bit of interaction today. I can see there's a few people who are already logging into the YouTube comments already, but really looking forward to bringing this live podcast recording to you today. But Alicia, we've got you in live from Melbourne. How are you doing today?
Not too bad, Jason. I'm in house arrest here in Melbourne, so I'd say I'm great, but it's just dealing with lockdown 6.0 here in Melbourne. But in Perth over there, you've got your freedom, so I'm sure you're doing better than me.
Yeah, I really feel for the people in Victoria and New South Wales at the moment who are going through some hefty lockdown measures. Yes, we do have our freedoms intact. Hopefully, we'll have an AFL Grand Final here announced soon. First one ever. So we'll see.
Maybe.
We will see. But yeah, definitely not going to rub it in your face. I know it's pretty tough at the moment, and glad that you could have an outlet through the live podcast.
Yes. Looking forward to today.
Yeah. So for those of you who are new to the live streaming that we do, be aware that we do stream to YouTube and LinkedIn. However, we'll be taking comments directly from YouTube. So if you want to ask any questions live of Alicia or of myself or contribute to the conversation, feel free to jump onto the FlourishDx YouTube channel and follow along and participate. We had some really great questions and interaction last week, and hopefully we have the same today. We will also be releasing this recording as a podcast episode on Thursday this week on the Psych Health and Safety podcast. But today, Alicia, as I mentioned on the outset, we want to talk about psych health and safety in healthcare. Dr. Jan Smith did a really great job of talking about some of her experiences consulting to healthcare and some of the unique challenges, particularly during the pandemic, that healthcare workers were experiencing in terms of psych hazards. So looking forward to exploring that a bit further. A few things in particular that we want to touch on today's agenda. So first of all, the issue of burnout amongst healthcare workers, so specifically nurses and doctors as a result of the pandemic. The main workplace psychosocial hazards in healthcare and some of the ones that are more prevalent during this pandemic. And what can we learn from the impact of the pandemic on the healthcare industry and other related industries where we have helping professions or frontline workers? But first of all, Alicia, I thought it might be worthwhile describing what burnout is. There has been an update by the World Health Organization for ICD-11, so that's the classification system for different illnesses and diseases. This new ICD-11 is coming out at the beginning of next year, so 2022. But there has been a slight change in the definition, specifically making it really pronounced as an occupational phenomenon versus being an illness like a mental disorder like depression or anxiety. But I might just read out the definition, Alicia. So burnout is a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. It is characterized by three dimensions: feeling of energy depletion or exhaustion, increased mental distance from one's job, or feelings of negativism or cynicism related to one's job, and reduced professional efficacy. Burnout refers specifically to phenomena in the occupational context and should not be applied to describe experiences in other areas of life. So that's that big change that's coming out in ICD-11, really making it known that burnout is an occupational phenomenon and so should be related back to people's work conditions and not be confused with symptoms of depression and anxiety.
Yeah, and I guess the key is, if burnout is occurring, and it's not addressed, it can lead to other more serious mental health conditions like major depressive disorder or generalized anxiety or any other, clinical mental health condition. So it's really important to, like you said, it's now recognized as a syndrome of a workplace, and it's underpinned by chronic stress in the workplace. So, the longer that stress coming from work factors is left unaccounted for, the greater the risk of mental ill health for staff.
Yeah, absolutely. And it's interesting, right? It's burnout isn't caused by a lack of resilience or a lack of self-care. It is caused by workplace conditions and chronic stress caused by work factors.
Yeah, that's right. Yeah. So, if your interventions or your strategic actions related to your um, well-being or work health and safety strategy is resilience training or those individual targeted interventions, then you're not necessarily going to address burnout and reduce burnout. So you can measure burnout in an organization, and if burnout is high, you can provide support to individuals, but to actually address the burnout and help people recover from it, you're going to have to do more than just individual focused interventions or responses.
Yeah, so it's more than just dealing with the symptoms
Hmm.
and getting to the root cause. So, yeah, looking
Hmm.
at the workplace factors that are contributing to it. And obviously, treating professionals aren't going to be able to make those systemic or work design
Hmm.
changes required. But that's where workplaces can work really well with treating professionals under injury management, right?
Hmm. Hmm. Yeah, and even taking into account any um, data or feedback from EAP. They usually capture themes and feed those back to organizations. So if the theme's coming back around, they usually break things down by work factor. So if it's related to um, uh, change in the workplace or workload, it's really taking note of what are the work factors that are getting fed back through different avenues like EAP trends and themes, or through any um, psych risk assessments or surveys that you may run through different avenues like EAP trends and themes, or through any um,
Yeah.
psych risk
Now,
assessments or
Ed
surveys
actually
that you
has
may
an
run
interesting
through
question
different avenues like EAP
regarding.
trends
Sorry,
and
I'm not
themes,
sure if
or
that
through
feedback is
any
coming through. Just trying to get rid of this for now.
psych risk
One
assessment.
moment. Sorry, I was just getting a bit of an echo there. So Ed asks, does psychological safety include those who work and are being exposed to domestic abuse? So it's actually something interesting, right? I've actually thought about this myself, and I'm not sure what your thoughts are on this. I don't actually have any solid thoughts on this, but obviously, with working from home being really commonplace these days, um, one of the uh, risks or hazards that people are being exposed to now is the potential of abuse from poor domestic relationships. Now, given that people are asked for work from home and they don't have a choice, is this a hazard that is the responsibility of the workplace or the employer to mitigate?
Mhm. I would say yes. Your workplace. I know it's difficult with working in a pandemic and people having to work from home. But if someone is experiencing domestic abuse or domestic violence, the workplace should be providing an option in a COVID safe way of being able to work on site, rather than not give those options, and then essentially you're placing that employee at risk because it is work time, and normally they would be able to attend a workplace.
Yeah. So, yeah, having that flexibility that the employer is providing, if people are self-selecting, hey, I don't feel safe at home, I need somewhere safe to work from.
Hmm. Yeah, that's right.
Yeah, it's an interesting one, and I don't think there can be hard and fast rules on it. But employers need to listen, and if someone is saying I don't feel safe working from home, then they need to investigate why that's the case and how they can respond to that. It does require a fair bit of trust, right? And the
Mhm.
willingness of employees to disclose if they don't feel safe working from home, and maybe even they have to give an explanation why to their employer if the employer is to listen.
Mhm.
So I can imagine it's a difficult conversation to have, but this is something that is a concern, particularly in places like New South Wales and Victoria at the moment, where there are these extended lockdowns and people are in these relationships, and stress is at a high. And if there's already not a great relationship at home and a bit of violence or abuse at home, then you can imagine that would only be heightened in these extended lockdowns.
Mhm. Yeah, exactly. And I mean, if you've got a work environment or a culture where it is high on psychological safety, meaning, your employees feel safe and comfortable to disclose um, mental health issues or things like domestic abuse or domestic violence, then it's more likely that you can respond in an appropriate way, and in a way where it's going to be helpful to that individual. But if you've got low levels of psychological safety, so people are less forthcoming about anything to do with mental health or any factors that might be contributing, even if they're personal ones, then your workplace or your manager can't really do anything unless you tell them what's going on.
Yeah. So that was a little bit of a tangent, but hopefully that gave you enough of an answer, Ed. I think it's a difficult one, but yeah, I think trust and flexibility is key to manage that particular hazard. What we are talking about on this particular episode, though, is more of a focus on burnout in healthcare settings. And one of the things that Dr. Jan spoke about on yesterday's episode was around the high rates of burnout in physicians. Obviously, this pandemic has been ongoing, and frontline workers are just being exposed to different variants of the virus now, and people. I think they were over it, probably 6 to 12 months ago. And these poor healthcare workers, seems like we're finally getting on top of the vaccines being rolled out. And then we have things like Delta come in, and there's huge influxes of people having to get acute care. And I did read an article the other day about how close to half of all healthcare workers are experiencing burnout at the moment. Um, and you can understand why, right? Just this uncertainty, the huge work demands, people working extra hours, not being able to take annual leave, so not being able to practice self-care and have that time out that they normally would as well. So really have to, yeah, I think it's very self-explanatory why there might be such a high degree of burnout.
Yeah, and it's not just when we say healthcare industry, we're not just talking about hospitals. Even I work in private practice, in clinical private practice, the days that I'm not working in this role, doing the podcast and working with FlourishDx. But it's just that even psychology in private practice in the community. You've probably heard about you know vast increases in people accessing helplines like Lifeline and Kids Helpline. It's just we're being inundated with calls for help and support. It's the impacts of the pandemic on people's mental health, and work is part of that because the pandemic has impacted work and workload and even working. I practice from a medical center, and even all staff in the medical center are having to do extra because there's now state-run rollouts for vaccinations, and we have to get vaccinations up to a certain rate by a certain time, and we've got influxes of vaccines coming in, and who's coordinating the vaccination rollouts on the ground. It's staff from community-run practices. So people are having to work extra days, extra shifts, coordinate people. There's student nurses coming in. It's just affecting a lot of people in terms of extra work at the moment.
Yeah, interesting. I was speaking to a healthcare provider over in the UK recently, and we are talking about psych health and safety, and they have been interested in applying more of a systemic approach through a health and safety lens for quite a while. But we've had to put it on hold for a number of months because, get this, their workers are too burnt out to introduce a new initiative. So we're talking about a system of trying to understand the employee experience and bring in changes to address psychological health and to keep people psychologically healthy and prevent burnout. But people are too burnt out to bring in a new initiative.
Yeah, that's just saying, we can't even think about how to do anything differently right now. We're just in this reactive phase.
Yeah, and clearly that's what's required at the moment, right? I mean, it would be great if organisations had the foresight to already have a good psych health and safety management system in before the pandemic. But we're in what we are at the moment, so really reactive assistance is highly required for these sorts of people. So what would that look like, Alicia, for healthcare workers at the moment? Do you think?
Yeah. So, we can't necessarily reduce the workload. We can't bring in staff. Organizations, hospitals, centers might need an extra 200 people to run this or roll this out effectively, but that's just not possible because where do you find these people, these professionals, in such a small amount of time? So, unfortunately, current staff are being overburdened, and it's thinking about, we can't necessarily change the work demands right now. But what we can do is increase, I'd say the main thing is one, increasing social support through the workplace. So social support comes from, so that's a um, psychosocial factor, social support in a workplace. So if you've got high levels of social support, it can act to buffer some of these demands that are, at the end of the day, they're unrealistic for an ongoing period, but they can just help in the moment for shorter amounts of time to buffer that, I suppose, insult to mental health. So social support comes from typically your colleagues, people that you work with, and your manager. So if you don't have good social support structures or opportunities in a workplace to, speak to colleagues, and when I say speak to colleagues, I mean about how each person is going and coping, and just to provide that level of support, and what can we do for each other, then you're not creating any buffers. So that would be the main one. And from what Jan was saying on yesterday's podcast is ensuring, from a management perspective or whoever's overseeing staff on shifts, ensuring that staff are getting breaks or taking their breaks, because there's a lot of working through really long shifts without you know eating or drinking or taking a bathroom break, and that's just you know um, basic needs. We need to have breaks in the day, not just for our mental health but our physical health as well. So I think they're the main couple of things that I can think of off the top of my head, for in terms of a reactive response.
Yeah, so we talk often about the demands resources model, right? Or
Mhm.
demands and supports. And while it's great if we can reduce demands like workload, for example, we can't always do that. As in this case, like you say, there's just not enough people around, and obviously, like various governments around the world are trying to draw people out of retirement, or bringing students in to assist overloaded healthcare workers with wave after wave of people getting ill because of the virus. Um, so what we need to do, as you're saying, is to build up supports, and that can be just through great supportive leadership or colleagues, and people having protected break times, which is one of the big things that Jan was talking about.
Mhm. Mhm.
And the problem with healthcare professionals is often they will put the needs of their patients in front of their own needs for self care, and obviously that can only go on so long until they're likely to experience burnout by having those demands and not enough self care being practiced.
Yeah, I think it's characteristic of people that choose to be in helping or caring professions that by nature, they are compassionate, caring people. So there is that tendency to, provide care over and above self care. So it's, really, and this is about the culture at any organization or any workplace, really promoting self-care as important to, I always use the analogy of the oxygen mask on an aeroplane. you are of no use to people unless you can look after yourself first. So if you don't, give yourself oxygen on a plane, and you give it to someone else first, you're not going to make it. You won't be of use to anyone else. So it's you know ultimately important to look after yourself, and make sure that you're doing the basics at work as a healthcare worker, for self-care, and that's
Yeah.
just starting breaks.
Yeah. So talking about, proactive or preventive interventions, obviously the horse is bolted in relation to workload. Um, I mean, there may still be ways to find efficiencies, but big change projects like, being able to get efficiencies by bringing in new IT systems, probably not a great time to start that in the midst of a pandemic, right? Um, so we really need to be thinking about, what are the supports that we can provide to these workers, and protected break times is something that Jan spoke about, and even staff having a room where if they can't leave work, actually just be able to go into a room, shut themselves off from their surrounds. I think she said that there were some people that even did a GoFundMe to get a massage chair so they could have a bit of me time, shut off from the world, allow the parasympathetic nervous system to kick in, turn off that, runaway stress response, and just chill out for a bit before going back into the havoc.
Yeah, and that sounds great in theory, but then I would wonder, if people are really inundated with patients or caregiving, would they actually take the time to remove themselves if they're not even, and sit in a chair or sit in a room if they're not even feeding themselves or giving themselves the time to eat? So, um, yeah, all of those measures are great, but it's really ensuring, um, and checking in with staff and making sure they're actually taking breaks, not leaving it up to that staff member just to, you know, um, uh, rely on, they're taking their breaks, when a lot of the time that's not the case. So checking in with your staff as a, nurse. On wards, there's nurse unit managers, really making sure those people are checking in with staff and making sure they're looking after themselves.
Kind of reminds me back in the day when some companies, construction and miners, were practicing fly in, fly out, and really not wanting to make a move on their rosters. So to control the risk of fatigue, they would bring in nap rooms. And every now and again, you'd find a nap room with like these really expensive like nap chairs or pods or whatever that were turned into a storage room because no one was using them because they didn't
Mhm,
have
mhm.
the trust, or the space, or the culture that would actually encourage people to, or they felt that they could actually make use of those rooms if required.
Yeah, exactly. And that's a good example of, having resources or offering timeouts. But if you don't have the right culture or the right systems in place to encourage use of those, then they just will probably go unused.
Yeah. So I'm interested in your perspective, Alicia. Obviously, healthcare had been caught on the hop with the whole pandemic, and
Mhm,
really not having the best systems in place to support the psychological health of employees during a pandemic that stretches for months and months, or more than a year, and probably going to be multiple years, right? Um, what can maybe some of our other frontline workers, I'm thinking police, fire, even education, you know, what might they be able to learn about the healthcare experience, and what they could be doing now preventatively to prepare themselves to support staff, knowing that we're about to go into fire season, for example, here in Australia in the coming months. These things are foreseeable. So what can we do around systems to support the psychological health of workers if we've got some time up our sleeves, which we do have in other professions?
yeah. So, there's crises that aren't foreseeable, like a pandemic. Nobody saw that one coming.
Oh, Bill Gates did back in 2015, didn't he?
But for things like, bushfire season, we know that that happens every summer. And um, I'm pretty sure that the relevant government departments in each state have, measures in place, control measures in place to ensure that there's enough staff at that time, that, there's processes in place to make sure that staff don't get necessarily caught out, that if they do need support, there's support structures in place. So it's probably a good idea for another upcoming podcast, Jason, to have someone from that kind of area speak and see what they're doing in that space. But really, I think it's around, from a systems perspective or a work design perspective, looking at workforce management, how are the relevant departments or areas managing workforces. So, having reserve staff or staff that are only needed at certain times in the year, or like you said, accessing retirees if we're talking about policing, even fireys, increasing the volunteer network at particular times of the year and ensuring there's enough staff at that time of the year to service, something foreseeable that will require a response. So this is an example of when we're talking about preventative and proactive systems for psych health and safety, where health and safety needs to really work with HR. So when I think about workforce management, that's more of an HR function than a health and safety function. But really, they need to be working together when there are foreseeable risks of that nature, where you're going to need more staff at different times of the year.
Yeah, and that's something we talk about a lot on the podcast, right? The need for HR and health and safety to work together on psych health and safety. It's not just one portfolio or the others. There is close, and like you say, workforce management is a really great example of where there has to be very close alignment.
Yeah, it's not workforce management sits over there. They're crunching numbers or doing their own thing. They really need to be working in collaboration with the health and safety area, and thinking about what are some of the risks to staff mental health from that lens, from the workforce management lens.
Yeah, absolutely. So one of the things that I really hope that all companies start to realize is that burnout is a real thing. It is an occupational phenomenon which puts the burden of the managing the risk on the employer, and it shouldn't be pushed down on the employee. And the poor employees' expected self-care is going to solve all of the burnout issues. We really need to be thinking at the root cause of the work-related stress and dealing with it there. The problem is, as we've identified during the pandemic, particularly for frontline workers like those working in health, is that work gets busy. And if things get flat out, then it can be really difficult to bring in a new initiative or a safety management system at that point in time. So hopefully, other industries where there could be, these big demands put on them all of a sudden, and some of them, like we're talking about, like, bushfires, it is foreseeable, then hopefully, they start thinking about what they can do in anticipation for that, rather than, just, increasing supports and resources. What are the things that we can actually do to reduce demands or make them tolerable, at least, even when we know there's going to be influx of work demands?
Yeah, and that they really are. Some of the top work hazards that lead to burnout is these, unmanageable workloads over extended periods of time, and unrealistic time pressures. So there's various other contributors, but they're all work hazards that will ultimately lead to poor mental health outcomes. So we've talked a lot about some of the other things, like lack of role clarity, incivility, bullying, which was mentioned by Jan yesterday, which is not just for healthcare sector, but for healthcare industry. It's not just an industry specific problem. It crosses all industries and sectors. This, I spoke about it before, but that maybe not enough social supports that can be coming from the workplace, from colleagues, from managers, organizational support. So really just building those as well. And it's this, combined approach. It's not just one response. You need to be thinking about multiple factors that you can change and or implement.
Yeah. Well, Alicia, we're not having too many questions today, so I think
I think
it's my wife's.
there's one new one.
Oh, yeah. So it's a bit off topic, this one. It's asking anonymous user, should an employer perhaps consider a person's criminal history relating to any psychological issues when looking at psych risk assessments? Yeah, so look, what we're really talking about in relation to psychosocial risks is not looking at individual risks or mental health history or criminal history, but we're looking at the risks that are within the control of the employer. So looking at work environment factors. So as Alicia was just talking about, things like workload, autonomy, role, relationships, that sort of thing. Now, there may be certain roles where a job function or job description has demonstrated that there is a specific need for further assessments. Kind of like if someone's going to be doing a really physical role, then there might be a medical assessment looking at their capacity to lift heavy loads, looking at previous back if has this person had a bad back previously, that sort of thing, to make sure that they are not putting themselves at risk. So there may be some, Alicia, but I'm thinking, what we're talking about primarily on this podcast and the psych health and safety approach is looking at those work environment factors rather than the individual risk factors.
Yeah, that's right. So when we say psych risks or psychosocial risks, it's any risks that are being presented by the workplace, the work environment, not from individuals.
Yeah. So there may be times, outside of what we're talking about, there may be times when those sort of things might need to be assessed. But what we're looking at is, particularly work environment factors, work design factors that contribute to people being burnt out. Like we're saying, burnout is an occupational phenomenon, not an individual phenomenon. So that's where we need to start. Great. Thanks for your question, anonymous LinkedIn user. So, Alicia, it's my wife's birthday today. So I might actually take this time to take a bit of an early mark on the podcast. We'll keep it nice and short today. Unless you've got anything else that you want to add.
I think we can call it a podcast and let you get back to your wife, and she is probably waiting for you to give her all the spoils, Jason.
Yes, probably. So I better rush off and do that. So look, listeners, this episode will be released on Thursday as a Psych Health and Safety live podcast on the Psych Health and Safety podcast. We will be back next week. So Joelle and myself will be on again next week on the, what is it, the 1st? Is it the 31st or the 1st? The 31st of August for another Psych Health and Safety live chat. Really interesting one next time. We'll be following up on a podcast that will come out on Monday, which is all about psych hazards in news and social media. A really interesting discussion we had. One of my favorite podcasts to date that's coming out on Monday next week, Alicia. So check out that one and feel free to join in the conversation next Tuesday. Make sure you register on LinkedIn and we'll post up the YouTube link for you to participate there as well. So that brings us to the end of this episode today, though, listeners, and we will catch you next time.